Today we will discuss lower back disorders, various of lower back disorders. Many people suffering from lumbalgia, pain in lower back, with no irritating, with no neurological picture, just significant intensive pain in lower back, one side, in the middle, both sides, lower back region pain. Some people suffering from abnormalities known as a radiculopathy. It's irradiating pain, means on the spinal level, spinal nerves compressed by herniation of disc, bulgings of discs, or combination of compression, irritation of spinal nerve. I should say irritation as a result. Muscles include piriformis, accumulating tension until start on peripheral level to compress sciatic nerve and will awake neuralgia, means neurological pain, most in tooth pains, most intensive pains that we experience. All this considered to be lower back disorders. I always said that massage therapy must be utilized as a preventive effort, being this in stress management, prevention of back and limb disorders. It's a huge power. If we will look over this skeleton, look, this is the skeleton lumbar spine. 5 lumbar vertebrae. Between them we have intervertebral disc. This is facet joint, and of course here additional 2 ligaments and tendons, muscles. And if somebody is staying gravity, and this gravity on region, on lower back region, include pelvic, sacrum also kind of includes sacroiliac joint, experience this gravity when we stand vertical. Yeah? And for example, gravity will be on this region 150, 200 pounds, no matter how this gravity will be dividing, mostly have to be carried this weight bearing on muscles, of course, and much less on intervertebral disc, facet joint, etc. Now, sometimes people accumulating due to reasons of stress, physical overwork, people working out, involved in sport activities, and do not rehabilitate themselves from overtraining.
The lower back region is a fairly complex anatomical structure. It contains many components such as the intervertebral discs, facet joints, spinal erectors, and rotator muscles. There are also stabilizers like abdominals, including lateral abdominal walls, etc. Therefore, when athletes sustain sprain-strain type injuries in the lower back region, it could result in multiple anatomical component traumas. The lumbar spine region is a very important component of the lower back. It is connected to the sacral region of the spine, including the innervations of lower extremities. The lumbar spine region is composed of vertebrae and intervertebral discs, which in turn is composed of annulus fibrosus, a very strong connective tissue, and nucleus pulposus, the internal fluid. Intervertebral discs supply the shock absorption to the spine, making sure that the vertebrae don't hit each other and contribute to the general range of motion in the region. There are also lots of muscles responsible for keeping us up in vertical positions and allow our bodies to rotate. All of these muscles are attached to the bones by tendons. When the lower back is subjected to a sprain-strain type injury, the lumbar spine region is very vulnerable. When sprain strains happen to muscles and ligaments, all components of the lumbar spinal column are traumatized. These traumas may consist of disc herniations, the development of muscular syndromes, or chain reactions of the neighboring non-traumatized muscles, reacting to these painful localizations by starting to accumulate tension to the pathological level. Therefore, Borch proposes how to perform self-rehabilitating steps that will affect all of these potentially injured components, and comprehensive treatment that stimulates the healing process of the entire lower back region.
The role of post-event sport rehabilitative massage is to manage this exercise stress side effects. And let's say if this not managed, and this 200 pounds, and when muscles accumulate tension, they demonstrate insufficiency. Means this 200 pounds will sustain, but will be dividing more, will go on intervertebral discs, facet joints, ligaments involved in it, etc. Now, with time, muscles will accumulate so much tension that will produce muscles, and with time, fascia will accumulate tension that will produce significant pain. We call this myofascial pain. People coming to the doctor, I have terrible pain, they do MRI, they're like, no, you don't have problem. And people were happy, I have no problem, but he cannot function, he cannot live normal life, he cannot sleep, every movement causing him pain. This is myofascial pain, cannot be detected by radiological means on palpation. We do perfectly well in this case, is very effective with performing connective tissue massage, we're performing in kneadings, we're performing the other stuff that helping us to fight these myofascial tensions. Now with time, because discs start working overtimes and facet joints, overloads start compensating this weight bearing, the inside of disc nucleus start dehydrate. This is empty in case, of course it's not, there is inside fluid, peripheral annulus fibrosus. This is ring that hold and causing this shock absorption, preventing vertebrae to hit each other, preventing too much load on facet joints. Yeah, but due to overwork, compensatory weight-bearing work, this inside nucleus start to dehydrate, and little by little it start bulging, because less mass quantity of this fluid within nucleus, and this is bulging. But people continue to use, and muscles will kind of accumulate more and more tension, will demonstrate insufficiency, and this bulging little by little will so weakened inside the microscopical fissuring that one day it will the fragment of nucleus pulposus will herniate, it will tear and will come out and will sit, will compress. Of course, bulging also can irritate or compress the spinal nerve, and this is not pleasant stuff. This is, you see, the nerve will be compressed, a reflectorial spasm, edema immediately, accumulation of excessive amount of extracellular fluid, venous blood, so there's all this stuff.